As far as the blood is the other one that we do. We do a lot of blood work in the clinic. And again, we're looking for disease situations. We're looking for issues that are in older dogs. And we're looking for any problems that might crop up prior to surgery. Very simple test that we do as far as in-house. Of course, the laboratory does all the hard work. Is we have a needle and a syringe. We have to draw the blood just like they do in people. Primary area where we draw blood in dogs and in cats is from the jugular vein, which is right here on the side of the dog's neck. I'm not going to shave her today because a friend of ours brought her in, but we actually shave the hair underneath the throat right here, and we can turn her a little bit more this way, and we will actually hold the blood vessel off, and then with a needle and syringe we'll take the blood from the vein right here, right underneath the neck. So if you're always curious about when you take your dog to your veterinarian about how and where they do draw the blood, this is one of the primary areas that we use. The other area is going to be in the front leg. There's a large vein right here on the front of the leg, and many times we will draw blood from here. It's easy access, and in some circumstances, but fairly rarely, and I'm not going to turn it over, but we'll actually draw from the outside of the rear leg. The one underneath the neck is the easiest one to do, believe it or not, because it causes the least amount of discomfort. In cases where we need to get a clean stick or a sterile stick from the bladder in dogs, instead of doing what's called a voided sample when we follow behind them and capture urine, we'll actually use a syringe and a long needle. And what we'll do in those circumstances, see if we can roll her over, is we'll actually take the needle syringe, feel the bladder, and we'll actually place the needle in the bladder and draw the urine from the bladder. This is really good to make sure that if we're going to be doing cultures or we're worried about other infections, gives us a very, very good sample and is very quick and easy to do. And we do a couple of things in processing it. We'll actually put them in certain types of tubes where we spin these tubes down. We collect the fluid off the top of the blood, and those are that particular liquid. It's called serum. That serum is where we look for our blood profile, and that's where we get our chemistries and our laboratory results. The purple top tube is there's a lot of different types of tubes out there. This particular one is going to keep the blood from clotting, and when we run the test on this, we're looking at our CBC, or complete blood count. It'll also get a white blood count. We'll see what our white blood cells are doing. Are they reacting to a potential infection? If they are, then they're going to be elevated. If a dog has an allergy, many times we'll see certain types of white blood cells that show elevations, such as one called an eosinophil. And that one might be elevated in heartworm disease and in intestinal parasites. With that blood, we also make slides. These smears, the blood is placed on these slides, and we physically make a smear. We actually smear the blood out so that we can just spread out the cells. And once it's dried, we run it through a staining technique so that we can identify those cells. Those cells are then counted. Now, we can do that manually, but pretty much everything now is done by machine. So we'll get complete counts. We can also do cell differentiation on these slides, and the equipment nowadays can tell us what's going on with our blood and our blood smears and our chemistries. In the urine aspect, I always get a kick out of this, and I tell people, I don't send this home with them, but this is our urine collection apparatus. It's kind of a little cup on the end of a fly swatter is what it looks like. And we unfortunately have to follow the dog, or not the cat. This doesn't work in cats. We follow the dog around outside until they urinate, and we collect our urine sample from there. Those samples are also sent in tubes, very similar to this one, and they go to the laboratory for analysis. They'll actually do various different types of analysis in the urine, chemistries that do tell us what's going on. Do we have diabetes? Do we have a urinary tract problem? Do we potentially have a diet problem? And that urine is spun down and then examined underneath a microscope to look at for crystals and debris that might indicate if we have specific problems and specific cell types that we're looking for. Sometimes cancers of the bladder and the urinary tract can also be shown in these slides. The reason again for all of this is to prepare not only for anesthesia and surgery, but also to test for disease and illness so that we can try to work in treatment and prevention for the future.